There is a prescription for change in the natural state as Arkansas becomes the first in the country to draw a clear line between those who manage your medicine benefits and those who dispense those bills. 5 News reporter Jacob Luthi here now to explain the impacts your neighborhood pharmacy and potentially your wallet might have. Jacob?
Yeah, Darren, when a doctor prescribes you a medication, the insurance company alone doesn't handle how much it will cost. That's where pharmacy benefit managers step in. They help negotiate prices with drug companies and decide which medications make the cut and set up which pharmacies patients can use. But a new law is changing how that works here in the state.
Pharmacies should compete on a level playing field for the business of their patients.
Arkansas House Bill 1150, signed Wednesday by Governor Sarah Huckabee Sanders, bans pharmacy benefit managers, or PBMs, from holding a permit for the retail sale of drugs or medicine in the state. Supporters say they do not want PBMs to both set the price of medicine and dictate what pharmacies can be used, especially if they are sending them to one of their own.
We've had pharmacies close in communities all over Arkansas, which reduces access to vital services. Often in a particular county, a pharmacy may be the only healthcare provider there. This ongoing battle and pushing those companies, those pharmacies out of business will have established themselves as the only option within the state.
Andrew Mize, pharmacist and owner of Debbie's Family Pharmacy in Rogers, says he has had this scene play out directly with his own customers.
We've gotten to know them, we're on a first name basis, and then they come in, they've received a letter from a PBM that says, hey, your plan design is changing. You're going to have to now go to this other pharmacy if you want your prescriptions to be covered.
In a press release, Governor Sanders says, quote, "For far too long, drug middlemen called PBMs have taken advantage of lax regulations to abuse customers, inflate drug prices, and cut off access to critical medications. Not anymore." One of the groups opposed to the new law is CVS Pharmacy. In a statement to 5 News, Lead Director of External Communications, Amy Thibault, says with the passing of the legislation, the governor is choosing to close 23 community pharmacies, fire more than 500 local healthcare workers, and increase the cost of Arkansas health benefits by millions of dollars each year.
And one of the arguments is, hey, we're going to be closing and taking jobs away from those people. There's nothing in the law that says that those pharmacies have to close. They just can't be owned by that company.
Mize believes at the end of the day, the new law is about fairness.
With the system the way it was, the patients may be forced to go to the PBM-owned pharmacy, or the reimbursements may be so poor for the other local pharmacies that they go out of business. Then you're only left with one option. And then they have 100% control of what the prices are going to be because there is no competition.
In a statement, CVS Health also says they welcome a good faith discussion with policymakers here in Arkansas and across the country on ways to make medicine more affordable and accessible. Darren, the new law goes into effect January of next year. Jacob Luthi, 5 News.